Hi, I'm Dr. Paul Collier. I'm the founder and director of the Swickley Vein Center. I'm a board-certified vascular surgeon who, for the last 22 years in Swickley, has focused on the overall treatment of vascular disorders. This includes arterial diseases and venous diseases. Up until the last few years, our main focus has been on arterial disease, mostly because the treatment and diagnosis in venous disorders has been so far behind the times. Veins have almost been an overlooked aspect of surgery and medical treatment. Up until recently, people with clots in their legs were just treated with a blood thinner and then given heavy stockings to wear to keep the swelling down. People with varicose veins were told to live with the problem unless the veins were so bad, in which case the treatment was almost barbaric. We did what was called a ligation and stripping, where we basically ripped the vein out of someone's leg. In the last few years, however, the diagnostics and treatment of venous disease has been revolutionized. The technology for imaging veins has been markedly improved, and the options for treating the veins has also been markedly improved. In the past, to diagnose venous problems, we needed to put a needle into someone's lower leg and put dye in there and take a lot of x-rays. Now, with ultrasound machines, which is a non-invasive technology that just uses sound waves, no radiation, we can define the veins, the anatomy, the valves inside the veins, and the physiology much better, so we can plan people's treatments. When we look at these veins, we look at a few things. We look at the system of the veins that's been involved, and there are actually 3 different systems in the legs: the deep system, the superficial system, and a connecting system called the perforating veins. We also look to see whether the problem is acute or chronic. When we look at deep veins, as I said before, the treatment used to be simply to anticoagulate the patient with a blood thinner, give them a heavy stocking to wear to keep the swelling down, and you were stuck with the problem for the rest of your life, basically. And these could lead to terrible consequences. People would get ulcers in their ankles, their swelling would be so bad that they wouldn't leave their houses. So nowadays we're focusing on trying to treat these more aggressively. With the advent of clot busters, we now find that some people with clots in their veins can have clot busters and get their physiology back to normal, so they're not plagued with problems lifelong. We're also finding that people who've had clots in the past may qualify for interventional procedures. Now with balloons and stents and even the lytic therapy, which sometimes works in a more chronic situation, we can open up veins that had been partially closed or totally closed in the past and help people relieve these symptoms that they've been stuck with. We also now have some operations that we can help relieve that, which are not commonly done but are being more commonly done as we investigate into these problems. The other interesting finding is that many people with swollen legs who've had clots in the past have destroyed the valves inside their veins. There is new experimental work with valves that can be implanted just like a stent in the heart or in the legs. These are being done in 2 centers in the United States right now and show promising results, and if they pass the clinical trials, may be more available in the next few years to help people that have been plagued with chronic swelling and ulceration. The real revolution in the treatment of veins has occurred in the peripheral veins, the superficial veins. These are the veins that you can see in people's legs when they're walking around. They're bulgy, they're ugly, and they cause a lot of symptoms that people tend to ignore. People get chronic swelling, they get aching, cramping, itching, burning. Sometimes they get night cramps or feel like bugs are running all over their legs, all because these veins are working against you. They're causing chronic swelling during the day that, if it goes unabated, can lead to chronic problems. And again, what's new in the treatment of these veins is that we can image them much better. We can actually define where the problems are. We don't do the old procedure of ligation and stripping anymore. What we do now is a percutaneous procedure where we just put a needle through the skin and access the vein, and then we either pass a laser cable up the vein or a radio frequency cable called a venous procedure or a closure procedure up the vein, and then simply with local anesthesia we can basically eliminate that vein. It doesn't cause any problems anymore. We do these procedures with straight local anesthesia in the office. The patient walks in, walks out, can drive home and be back at work the next day. This is so different from the old procedure where patients spend a day in bed or a week in bed and really were off their feet for prolonged periods of time. When we first started doing this procedure, we actually gave patients a prescription for pain pills. We don't do that anymore because no one took the pain pills. The results have really been spectacular and people have been very happy with this. We're also finding that the treatment of the superficial veins, or the veins that you can see that are not necessarily qualified for laser, we treat much, much differently. In the past, people had large incisions, and I'm sure anyone watching this who's seen their mother or someone else who's had the procedure, it looked like railroad tracks going up their legs. We do not do that anymore. We make very small incisions that we measure in 2 to 3 millimeters and literally use what look like crochet hooks to tease the veins out from under the skin. Again, this is done with straight local anesthesia or Novocaine, and patients go home and they're back at work the next day. They're very pleased with the results. We also have what's called sclerotherapy in the smaller veins, where we can inject the veins, and have a newer thing called foam. And all foam is basically sclerotherapy where air has been mixed into the solution. The advantage for this is we can see it with an ultrasound machine. We can follow it and make sure the right veins are being taken care of, and it's very, very effective. We've been moving more and more into foam and away from sclerotherapy, and I think the patients are extremely happy with that. The other area is called the perforating veins. Now, most people this would not have affected unless you've had ulcers or monstrous swelling. And again, in the past, the treatment required a large incision down the back of the calf, or an endoscope placed under the skin and a few probes like that. Nowadays, however, with the closure procedure, we have a direct device that just through a little incision and some local anesthesia, we can place right into this perforating vein and take care of the problem. We've had people heal ulcers that have been indolent, that have had for I think up to 5 or 6 years, where once we take care of the perforating veins, these ulcers heal in about a month. Again, the patients have been very, very pleased with this. It's an outpatient procedure that we do right in the office with Novocaine and no sedation whatsoever. So basically, I think veins are coming into the forefront more and more because we can treat them so easily. And this has really been the revolution in vein surgery. One of the problems that we find, however, is that many people attempt to do these procedures and do not fully evaluate the patient, do not make sure that they're taking care of the problem, which is generally the reflux down the main vein, and only take care of the cosmetic aspects of that. That's a guarantee for recurrence and really should not happen. If you decide that you have symptoms, or you think you have symptoms, you should go to someone who's a certified vein specialist that does scan your legs and take care of these veins properly. Certainly, if you have any questions, you can always call our office and we'd be glad to answer your questions.